Mentavi Health's Mental Health Diagnostic Evaluation has just been clinically validated for the diagnosis of ADHD in adults, and the results have been published in the Journal of Clinical Psychiatry. Join Dr. Barry K. Herman and CEO Keith Brophy as they share what this breakthrough means for patients, partners, and the future of digital mental health.
Hello, I'm Keith Brophy, CEO of Mentavi Health.
I'm Dr. Barry Herman, Chief Medical Officer of Mentavi Health.
What was the rationale and philosophy behind the study design?
We felt confident that we had developed a valid diagnostic assessment for diagnosing ADHD in adults through an online asynchronous assessment. However, we often received objections or pushback from potential collaborators or partners who would challenge us on the validity of our diagnostic assessment. So we felt that we really wanted to back this up with scientific evidence. We wanted to design a study that would show that our diagnostic evaluation was no different from the current standard of care for diagnosing ADHD in adults, which is a diagnostic interview conducted by a licensed mental health professional who focuses on getting a history from a patient and then matching the diagnostic criteria for ADHD that currently exists. This is the current standard of care, and that's because there really are no current biomarkers for diagnosing ADHD, meaning there's not a blood test, there's not a genetic test, there's not a brain imaging test, there's no combination of screeners or psychometric evaluations that are going to be able to establish a diagnosis of ADHD in adults. The definitive way that we diagnose ADHD in adults is a clinical interview.
Mentavi Health was rapidly building a reputation as a leader in responsible diagnosis of ADHD. But still, there are many that question the approach. Mental health, telehealth is a relatively new field in the big scheme of things. It's been around for a couple of decades and really accelerated with the advent of COVID. The concept of carrying out mental health diagnosis through an online scenario, particularly an asynchronous questionnaire-based approach with separate review by one of our Mentavi psychologists, was a new concept.
Barry, can you walk us through the validation study process?
We were able to recruit subjects for a clinical study through our own website, which attracts somewhere between 150 and 200,000 people that are seeking online mental health care. And so it was relatively easy for us to be able to recruit interested individuals. In fact, we had somewhere close to 3,000 people initially that expressed interest in participating in our clinical study.
So we set out to do not just a clinical trial, but a clinical trial done right, with thousands of applicants for the trial, hundreds of participants in our formal trial, and not just our own team, but designed by a body of national thought leaders in ADHD.
Barry, could you briefly share with us the actual results of the study?
We were able to demonstrate that our online asynchronous approach to diagnosing ADHD in adults is just as accurate as the current standard of care, which is a clinical interview conducted by a licensed mental health professional. And our data were really quite compelling. First of all, we were able to show a high level of agreement between our approach and the current standard of care. We had somewhere approaching 80% sensitivity, which is very positive, and also showed a positive predictive value of 95%. We had a very low false positive rate, only 12%, compared to a much higher rate of false positives in the traditional way of assessing ADHD in a clinical interview. What that means is that if you receive a diagnosis of ADHD on our platform, using our diagnostic assessment, you have ADHD.
Why is it important to create an asynchronous option for people pursuing an ADHD assessment?
The asynchronous approach to ADHD assessment was important because it allows us to meet patients where they're at when they need us. We remove barriers of access and allowed them to take that critical first step to gaining insights at the time of their choosing without leaving their home.
We currently have a workforce shortage in the United States, a mental health workforce shortage. There just are simply not enough specialist providers out there to be able to diagnose and treat ADHD in adults. And being able to fill that gap through telehealth is a huge option.
The online mental health arena has some stigma, particularly in the arena of ADHD. Over the last several years, paralleling the rise of telehealth, there have been several ADHD-focused online providers where their practices and their approaches have been questioned. There's sometimes the perception that online ADHD diagnosis is providing an avenue for pill seekers, for example, or that it's not as effective in diagnosing. Mentavi Health thought it very important to show that our diagnostic approach is just as effective as traditional ADHD diagnosis.
What does it mean to you to be published in the Journal of Clinical Psychiatry?
The fact that we now have the data from our study, which was submitted to a respected peer-reviewed journal, the Journal of Clinical Psychiatry, and just published this week in that journal, is so important to us to have that seal of approval, if you will, from the scientific community about our approach in diagnosing ADHD in adults.
Getting published in the Journal of Clinical Psychiatry is a proof point to our partners, to our patients, to the industry, that the diagnosis of ADHD can be carried out online with an asynchronous, decoupled from treatment approach that is very effective and cautious and on par with traditional ADHD diagnosis.
So again, this is a landmark study not only for us, but for the industry as a whole.